Welcome to the office.
It's the crypto trader meets the crypto Chiro. How are you?
I'm great.
Nice to see you
Nice
again.
to see you again.
So, it's been about a month.
Mm-hmm.
How you doing, Eunice?
I'm doing great.
Okay. We had a great session last time.
Mm-hmm. It's been a very interesting session.
Okay. And one of the things that everybody wants to know about is when we did that muscle testing with the jewelry.
Mm-hmm.
And I want to clarify a couple of things first, right?
Sure.
And they're saying, well, why did you do it? And it was something that I was picking up, and I said, let's muscle test it and see. And it goes back to intention and energy. And what we found initially was that that jewelry was making you weak, and specifically the name brands.
Yes.
Right?
It's fascinating.
Okay. And then what we did was, after we found the weaknesses, first I was going to tell you to go and cleanse in the seawater, because it's a great way to cleanse energy. But then something came and says, no, this was based on intention of why we got it, and it went back to the heart chakra.
It's true.
And we cleared the heart chakra.
Ow! Oh, that was painful, but it was good.
Okay, so tell me what happened, and if you'd like to explain, because some people think, oh, he was pushing harder, he was pushing left. What did you experience?
No,
I'm curious.
it was really, it was just natural. Like my hand wasn't able to come up,
Okay.
right? No matter how hard you push. So obviously those items is actually bringing weight to my
Energetic weight.
Exactly.
Okay.
And I did a lot of reflection for the past few weeks or month, and I did a lot of cleansing as well, and realized that I was owning these things based on how I want to be seen in the world.
Not because you actually enjoyed
There's actually a sense of guilt and shame sometimes when I wear it.
Oh, interesting.
I used to remember that. I'd be like, yeah, I'm not sure. And when people compliment it, I'm like, yeah, I'm not sure, you know? I'm like, yeah, it's all right. So it's I want to be seen in that scene, but at the same time, I have guilt and shame.
And it's not specific to just here. It's everywhere.
Anyway.
It's wherever you go, right?
Exactly, whenever I wear it, really.
Right. And so, okay, so it's been a few weeks. You haven't worn it.
No, actually, it's been more than a few weeks.
How long has it been since you wore it?
I think last time I saw you would have been more than a month.
Okay.
So the whole period of time, I would say 2 months. I didn't touch it at all. I'm like, I didn't
Did you feel that you wanted to?
At one time I did.
Okay.
I was going out, so I put it on, and I was like, there's no meaning. And I was like, what's the point?
Oh, interesting. Okay.
And I
So
just
you
let it
haven't been
go.
wearing any jewelry?
I only wore the tennis bracelet that we had that was no brand.
Okay.
It was just no label. So that one was
Interesting.
okay.
Okay. And so I had asked you to bring it. I asked you to bring at least a watch and a bracelet. I haven't adjusted you. I haven't today. And I want to kind of see if it goes strong or weak.
Moment of truth.
You ready?
Let's do it.
Okay. And then after that, I'll get you checked out. Okay?
Okay.
So, which would you like first? The bracelet?
Just go with one bracelet, and then we go with the watch.
Okay. So before we do that, let's do a quick muscle test. Arm out. All right. So let's go ahead and do a basic muscle test first. Look straight ahead. I'll do it before the elbow. Push up. Strong.
That's the max.
Other side, please. Push up. Strong. Okay. Now, Cartier. Cartier.
The label.
Cartier. Cartier. Right side. Let's do the right side.
Okay.
Come nice and close. Push up. Strong. Left side. Push up. Good, right?
Yeah, I mean, I can wear it now, but I'm not sure if I want to, you know?
But you could.
I can, yes.
If you like
I'm stronger now.
If you like it, you can wear it.
Yeah.
That's your choice.
Yes. But the feeling is gone, you know? It's no longer there. The desire is gone. I do like this one, though.
Okay, well, let's see. Right side. Push up. No issue. That's really cool. Left side. Pretty cool, nurse. Push up. So,
what is the moral of the lesson?
The moral of the lesson is, number one, you purchase these items with the wrong intention.
Mm-hmm.
And that was,
which my body doesn't agree with, right?
Correct. Mm-hmm. And that was part of the image that you were looking for.
Yeah, I was trying to be part of the crew, right?
Correct.
To say like I've made it.
Or we say we're keeping up with the Joneses, so to speak, right?
Yeah.
But what we found, I'll put this away. Now, instead of cleansing, we worked on, besides the adjustments, we worked on heart chakra. Mm-hmm. And you're purging, you're letting go of stuff. And I think now that when we tested it right now, there's no intention of trying to show off to anybody. Excuse me.
100%.
Okay?
Yeah, use it. That's the
no,
word.
No filter. We're not trying
Of
to
course.
show off. If you like the watch, you enjoy the watch, wear it. And that's the moral of the story. When we're buying something, I mean, we like nice stuff, okay?
Look, doesn't matter what you say. It's a signal. Like, it's a signal. It doesn't matter what. I can look at the same time on my phone, so I don't really necessarily know.
Correct. We'll talk about cars next time.
Yeah, I was gonna go get one too, but I stopped. You know, I'm not doing it for now.
But you can.
Yeah, but what's the point?
If you enjoy it, do it. That's the moral of the story. If you guys enjoy it, do it. Okay? If you want to get something like that because you enjoy it, you like the timepiece, you like the engineering, the craftsmanship, the history, the story, something like that, get it. If you're,
I never care about that.
Okay, well then let's leave it. Okay.
Yeah.
But just so you know, you can wear it if you want to wear it.
Sure.
Cool.
Thank you.
You ready to get started?
Let's do it.
How's the jaw?
Oh.
You forgot about that, didn't you?
I heard that. Okay, let's do it.
Okay, so let's do this. Let's check spine now.
Mm-hmm.
Let's see what we got, and let's get you adjusted.
Mm-hmm.
You ready? Showtime. So actually, before we start, tell me how the body is doing.
So my lower body, which I had a problem with a long time ago, you kind of fixed it now. So it's at the mid section.
You're feeling more mid-back now?
Yeah.
Low back is doing better?
Yeah.
And neck?
Here, the right side, a little bit.
Okay, and we'll check the jaw if we need to.
Yes.
Okay. C6, C7, right side, 6 points. Whoa. C1, 15, 20. Right side. T9, T10. S3, S4. Mm-hmm. Feet together. Open and close your knees with your feet touching. Open and close. My hand is on the top of the hips too. Left side only. When she does the left, the whole right wants to shift. Right side only. When she does the right, there's less shifting. So we're going to work on this right hip. That's the work stuff. It's interesting how the left is tender, right?
Yeah.
But that, okay. Come back slowly in extension. Good. That's 5. That's 1. That's 2. That's 3.
Ooh.
3 or 4?
4.
4.
Yeah.
Okay, we have S4 right hip. Let's check. 1, 2, 3, 4, 5, 6, 7, 8, 9. T9, S4 right hip. Now we're going to do a test to determine the neck. Mm-hmm. Sit back for me, please. It's called Divore's test, and we want to isolate the upper versus the lower because we have pressure in both. If we look up, we're isolating the lower cervical spine, and we're isolating the lower cervical spine. Turn left, turn right. Little tight on the right side.
Yeah, when you do that, I can hear the crackly sound.
On the top part or the bottom part?
When you were doing this, it was like up here, I think.
Up here, right?
Yeah.
Okay, now head down. We're isolating the upper cervical. Head down, turn left. Head down, turn right. So if we look and compare this, watch. Down and right and up and right. Which one is more restricted and bothersome?
Up. I think up was like less movement, right?
Yeah. So we're going to do C6, C7 instead, and then we'll check C1 at the end. Got it?
Okay.
You ready?
Mm-hmm.
Let's go. I'm going to be doing the pelvis.
Oh, man.
Let's cover it up. Hold here. Nice and easy.
Okay.
Nice and easy there. Let it roll slowly. I'm going to push up there. You got to let it roll. Good. Hi. Gotcha.
Yep, got it.
Home run. All right, we're going to introduce the Cobra to Dubai. Whoa, you ain't going to get the Cobra. Bah! Gotcha. Come on up. Let me close you up.
Woo.
And let's walk it off. Walk to the corner of the room and back, please. Walk 2 times back and forth. Mm-hmm. Mm-hmm. Still going to work a little on that ankle, but not as brutal as last time. A little bit.
Is this still swollen?
Tiny bit. It's actually on the left.
What?
The left is a little more swollen on the inside.
I have no problems on the left.
I'll show you.
That's interesting.
I'll show you.
I didn't roll it there. I'll roll it on my right side.
Okay, but I'll show you what I see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 9. Nice and easy there. Perfect. 1, 2, 3, 4. You know, that next person or the next thing that needs to be forgiven or released. You ready? 1, 2, on 3, 3.
Wow.
There you go. Nice. We'll use the machine at the end, don't worry, okay?
Yes.
Now, any advice for people out there?
About?
Just life, going through the process, holding stuff in their body.
Yeah. I mean, it's good to do things like this to help you release. If not, you're just going to keep it there, right?
Correct.
I don't want to keep it there. I realize there's two types, right? The body that keeps it, and it's also your mental.
So the physical and the mental,
Yeah.
right? And then we have the psychosomatic. And I gave an example earlier. There was a patient, I just want to say this before we continue. Mm-hmm. And I gave him his answer 4 years ago. I gave him his answer first week. In 4 years, I saw him 380 visits. 380 visits. Yeah, 380
Wow.
visits. And it got to a point now, it's like 1 or 2 segments every time. And he would rather come for the adjustment, okay, than deal with what I was telling him to deal with. And he finally got to a point where he let go of maybe 70% of it. Now I see him maybe once every 2 weeks, once every 3 weeks. But the point is, I gave them the answer, and then it's on the person, it's on you.
Yeah.
Right? It's on you.
If you want to let go, like in the mind, right?
If you want to let it go, it's up to you to let it go. And there's a great saying, it's accept the situation as it is or let go. Mm-hmm. If you cannot do either, there's conflict. If there's conflict, there's no peace. Mm. It's
exactly.
It's that simple. Okay. Let's recheck that. Look up, turn left. Look up, turn right.
Ah, I can hear it.
Yep,
here.
right there. Nice and easy. It's the Crypto Chiro. Nah. Down.
Oh.
Come on. Really? That was not it. Okay, let's do it again. Chin back. Look up. Slow it down. Slow it down. Look up. It's getting tight right there. Easy. You're holding. Stop.
Ow!
Gotcha.
Whoa.
There you go. Walk it off once and come back, please.
So can you tell me, so he did 380 sessions just to try to let go?
No, the body he wouldn't let go.
Oh, so you mean...
He won't deal with the issue. And because he's not dealing with the issue, these subluxations, these nerve pressures don't hold.
Oh, so you mean the adjustment doesn't work?
The adjustment doesn't hold.
Doesn't hold.
I clear every visit.
Yeah.
But because they're not doing what they're supposed to do, whether it's the letting go or accepting, that psychosomatic manifestation keeps happening. Mm-hmm. Look up. And we learn in chiropractic school the 3 causes of subluxation, the 3 T's: traumas, slips, falls, accidents. That's macro. Micro traumas, mm-hmm. posture, and habits. Toxins, chemicals, food, right? But 80% is thoughts, mm-hmm. stress. And the way we relate the stress component is when we're in fight or flight, we have high cortisol. Cortisol in high concentrations, long time, becomes a tissue toxin. Mm. It makes the tissues weaker and more susceptible to injury. Fight or flight.
Yeah.
Neck is clear. T9 is clear. Tailbone is clear. Come back and feel. 3.
A little bit there. Yeah.
It's moving. A little tender though?
Mm-hmm. Just a little bit.
Okay, now we just got to do the machine work. Shoulders, right side, drop. Left side, breathe in. Go. Ears.
Ah!
Go on your back, please, over here. Let me show you what I was talking about. Come over here.
Ah, yes. What's that?
That's the right.
Yeah.
So, right side, over here.
Yeah. Ah.
Okay.
Yeah.
Left side.
It's also, yeah.
Both of them.
Yeah.
Okay.
Why? Did I break them?
No, you didn't break them. This one still needs an adjustment, but I'm finding the right today.
I broke my ankle a long time ago, right? So there's an injury.
Next time, I see next month or the month after, whenever it is in the future, let's get some ankle x-rays.
X-ray, okay.
Yeah, ankle.
Okay.
Or if you're coming to LA.
Okay. Ow.
Talus, fibula. Back in the chair. I'm just checking. I'm just checking. There you go. Sit back for me, please. Cool. All right. Your homework is the same. No new variables. Walking, icing, and continue your process of letting go, okay?
Yeah.
Slowly open, open. I'm going to work slightly on this side here. Okay, open all the way, open. Close half, hold right there. Nope, open, close. 4, 3, 2, 1. Open, open. Close, close, there, close. It's still there. It's still there.
What is due there? What's due there?
What's that?
What is due there?
This is tight. So the jaw is we're working on jaw alignment, but we're also working on the muscles in here. Okay, 5, 4, 3, 2, 1, 5, 4, 3, 2, 1. Okay, let's do the machine today. I'm not going to go too brutal on you today, unless you want it. 5, 4, 3, 2. 5, 4, 3, 2, 1. Let's check. Open. Open all the way. Close halfway. Right there. That's it.
Oh my God.
There you go. Left is still compensating for the right. That means personal is still compensating for the work. Just saying.
Yes.
Just
I'm
saying.
aware,
I'm
aware.
just saying.
I'm aware.
I'm just saying.
The time will come.
Posterior ulna. Posterior lunate.
Oof.
Scaphoid. That's bonus. Squeeze. Relax there. Relax there. Squeeze. Squeeze. Questions?
That felt good.
Good?
I like it.
Okay, so we're all set for this trip.
Mm-hmm.
Cool?
We good?
We're good. Enjoy your journey.
Thank you, sir.
Have a fantastic summer. If you're here, I'll see you here. If not, maybe I'll see you in LA.
I'm sure I'll see you in LA
All right,
at
take
some
care.
point.